Good morning, ladies and gentlemen. Welcome to the Greater New York Hospital Association. I am Ken Rasky, president of this outstanding institution. Today is a really big day in healthcare, and I'm glad that you all could be with us for what will be a spectacular announcement emanating from Governor Cuomo's office. We're going to be talking about healthcare reform and investing in New York's hospitals. Isn't this a beautiful sign? Doesn't that capture it all? I love it. I want to welcome a number of our guests, some of which will be speaking. Of course, our commissioner, Dr. Howard Zucker, I will introduce in a few minutes. And I would also like to introduce the president and CEO of DASNY, Gerard Bushell. Gerard, it's always a pleasure having you here. You've been a great friend over the years, and I appreciate it very much. And Rick Cook, friend, colleague from the Healthcare Association of New York State. I believe Paul Francis is going to be coming from Deputy Secretary. He should be here shortly, and I'll welcome him as he enters the room. For the past 5 years, under the leadership of Governor Cuomo, we have made great progress in healthcare reform. We have cut Medicaid spending, reduced inefficiencies, and improved patient outcomes to create a better, smarter healthcare system. Today, we are continuing down that path to improve patient care, upgrade critical infrastructure, ensure New York's hospitals are capable of meeting the growing demands of the 21st century. I have been blessed in my role as president of the Greater New York Hospital Association to be a leader of some of the greatest institutions in the world, bar none. And we want to keep that position of world-class, first-class, so that the best of patient care can be delivered to all of New York's citizenry, and to make sure that every man, woman, and child in New York has the best of patient care. And we are certainly committed to it. And the best part about it is that Governor Cuomo is a partner who has exhibited leadership beyond belief in this area. His commitment to health care is probably the best commitment of any governor in the United States. And I mean that sincerely. And I've seen a lot of other states who would die for the kind of leadership that we have here in New York. And I certainly do appreciate it very much so. Now it's my pleasure to introduce really the gentleman who is going to be making the announcement and talking about the program that we're having here this morning in terms of capital awards. His name is Dr. Howard Zucker. He's been a great friend, a colleague. Howard and I have worked on numerous projects, but some really difficult ones. Ebola being one that has been challenging to everybody. And we are fortunate, blessed to have Howard Zucker as our Commissioner of Health. And I mean that sincerely, Howard. Come on up.
Thank you, Ken. It's a pleasure to be here on behalf of Governor Cuomo to announce a remarkable $1.5 billion investment in the state's health care delivery system. These 162 awards will enhance the quality, the financial viability, and the efficiency of the state's health care infrastructure. The investments announced today will help achieve the governor's overall goal of transforming New York's healthcare system into a more rational, patient-centered system that promotes population health and improved well-being. These awards will support capital projects from Buffalo to Long Island that will help strengthen and promote access to essential health services. They include projects that will improve infrastructure, promote integrated health systems, and support the development of additional primary care capacity. The projects are co-administered between Department of Health and DASNY, and I thank Gerard Bushell for all your work and our collaborative efforts on this. These awards will help to redirect patients away from costly emergency room care into an environment far more likely to deliver the results at a proportionate cost. They will transform financially struggling hospitals into sustainable healthcare providers for their communities. And they will help provide primary care to people who don't have a personal primary care provider. Let me tell you a little about the story of these awards. It actually begins in 2011 when Governor Cuomo created the Medicaid redesign team. And that began to overhaul our whole entire Medicaid system. The state's share of Medicaid funding that year was growing at an unsustainable rate. We had to put a stop to that, and delivering less care was not an option. One of the keys was to phase out the fee-for-service model of reimbursement, where a healthcare provider's income was based on how many procedures they did, and replace it with one that's rewarded value over volume by focusing on keeping people healthier and providing the right care in the right setting at the right cost. Over the first 4 years, the Medicaid redesign team efforts saved billions and delivered better health care. And New York's plan has been held up as a model for other states to follow. And based on this success, in 2014, we asked the federal government to allow us to take some of this savings and reinvest it into the initiatives that would further strengthen our healthcare delivery system by reducing costs and increasing wellness. The federal government listened and granted a waiver amendment that allowed New York to reinvest over a 5-year period billions of dollars in federal savings generated by the Medicaid redesign team's reforms. The waiver amendment is being implemented through the Delivery System Reform Incentive Payment Program, better known as we know it as DSRIP. However, the federal government would not allow us to use the federal DSRIP funds for capital projects. So the governor and the legislature stepped up and provided the $1.5 billion that we are awarding today for projects that will further transform our healthcare system. Projects that will direct people out of expensive emergency rooms where their needs can be better and more quickly met by less costly healthcare settings. Projects that will build more community-based primary and ambulatory care centers where people can get regular care and early intervention. Projects that will build medical villages where many health services would be collected under one roof. And projects that can create information technology systems that will allow patients' records to be seamlessly shared across a network of healthcare providers, enabling a much more coordinated system and also at lower cost. So one may ask, why are these projects necessary? Well, nearly 75% of all emergency department visits in New York State could be avoided, either because the patient's condition isn't an emergency, or could have been prevented with better access to primary and preventive care. The estimated cost of these potential savings is at $4.2 billion a year. So the awards that we're announcing today will help us meet DSRIP's goal of reducing these avoidable admissions by 25%, or avoidable ER visits by 25% over the next 5 years. And also consider that on average, 37% of inpatient hospital beds in the state are not utilized. A number of these awards will involve hospital transformation projects that the communities need that will reduce excess inpatient capacity and build more outpatient services that these communities will benefit from. So I have a couple examples that I wanted to mention a little bit about. For example, at Montefiore Medical Center, there's an expansion of a school health program. This project will open 21 new school-based health centers throughout the Bronx, and many more over the next 24 to 36 months, and many more parts of that system. At Mount Sinai St. Luke's Hospital, Mount Sinai system, this project will provide an on-site medical mall for integrated ambulatory care services. It'll provide an urgent care center for reconfiguring and expanding the hospital's emergency department, and also much more there as well. And also, another example is the Institute for Family Health. This is in Manhattan in the Bronx, and this will provide state-of-the-art primary care and mental health services. We're working very hard to tie together primary care and behavioral health, and this will be an opportunity for that to be achieved as well. And those are just several examples. These awards will also help support community-based clinics, which can provide the regular care necessary to help vulnerable New Yorkers avoid trips to the emergency department. In total, community-based clinics will receive 45 awards totaling $124 million. These awards will result in better health care for all New Yorkers and ultimately better health as well, all at far lower costs. So I thank you very much for being here today. This is truly a great day for New York, a great day for healthcare for New York, and we look forward to seeing what the next steps are as they move forward with these capital awards. I'm very proud to announce that these awards, which I will help bring significant improvements to the healthcare system, and I look forward to an opportunity to visiting these sites and different sites across the state as we move forward on this project. So thank you very much.
I told you it was a great announcement. Thank you. Thank you, Dr. Zucker. I would now like to introduce Rick Cook, Chief Operating Officer of the Healthcare Association of New York State. Rick?
I'm afraid I'm going to have to put this down or no one's going to see me. You can hear me but not see me, Ken. We're really here today to recognize a terrific event. I mean, this money is so important to the healthcare community, and not just the hospitals that we represent, but to, as Dr. Zucker said, to clinics and to other providers across the state. And I just want to emphasize a couple of points. One, as Ken said, the governor has been a tremendous leader and partner for the healthcare community, and we are extraordinarily grateful. He knew we needed to go beyond the DSRIP waiver dollars in order to transform healthcare, and he did, working with the legislature. So we are extraordinarily grateful, and this is really a great day, and oftentimes we don't celebrate things enough like this. The result of this, though, will really be a couple of things. Number one, as the commissioner noted, we are really going to be able to develop new models of care. We're going to be able to expand healthcare services in communities that have struggled to have good access. But maybe more importantly, we're going to provide stability in a lot of areas and communities where healthcare facilities have struggled to meet the needs of the poor. And though that kind of stability to help them find partners, to provide debt relief, to allow them to finance new projects, are dollars that are just you can't find those dollars in the private sector. Without the role of government, those communities would really have a significant problem, and more importantly, the people who live in those communities would have a great problem. So I really want to thank Dr. Zucker and the Dormitory Authority. They are extraordinary leaders in this field. They have really gone way beyond anything that we had hoped for. I know our members are really thrilled, but more importantly, the people around this state are really going to be served, and healthcare will continue to be transformed because of these capital grants. So thank you.
Great. So, thank you, Rick. So this is a historic day. It's a big day for everybody in New York. Anybody that cares anything about health care. It's a huge day, a victory for the people. And again, Dr. Zucker, my thanks to you, the great team at the Department of Health, and to our Chief Executive Officer, Governor Cuomo, who has championed the way for better health care in New York State. Thank you very much.